everybody, Dr. Chris, orthopedic surgeon and sports medicine physician, and today I am back looking at weightlifting injuries. I know you're saying that I already did this just recently. Because it was upper body heavy, now we're gonna go lower body. And there are plenty of injuries to cover. So let's get right into it. Here we have a competitor at a weightlifting competition getting set to lift the weight. As is common with competitive weightlifters, we see that he has one arm in pronation, meaning with the hand facing palm down, and the other arm in supination, meaning with the palm facing up. He sets up to lift the weight and he starts to generate tension. But we can see that as he stands into his final position of full extension, that something funny is occurring at the level of the elbow on his left arm. And we can see that his bicep, which was previously the full length of his arm, has now popped at the level of the elbow and moved up towards his shoulder. And when he reaches his final position of extension, we can see that the bicep on the left-hand side is only about 1/2 the size of the bicep on the right. So immediately we know that since the bicep moved from the elbow up towards the shoulder, that he has suffered a distal biceps tendon rupture. This means that the biceps has ruptured at its tendinous insertion at the elbow. And this injury typically occurs when the person is lifting heavy weights or when their arm is forced into full extension when the hand is in a supinated position. And if you want to remember the difference between pronation and supination, just think you are holding a bowl of soup. Supination. This injury will require a surgical reattachment of the biceps tendon at the radial tuberosity at the level of the elbow. Typically, this is something that we do nowadays through what is called a 1-incision approach. In the past, we used to use a 2-incision approach, but now more modern surgical techniques and modern surgical implants allow us to repair this injury anatomically through only a single incision. This is an injury which is quite common in weightlifting and in particular in deadlifting. And we see here that we have another 2 athletes that have suffered the same consequence as a result of this exercise. But if you were thinking that you needed to have your biceps in order to perform the deadlift, well, you were wrong. So here we see one of the world's strongest men attempting a world record deadlift. We venture to guess that this weighs well over 1,000 pounds. He's going to deadlift it without a biceps, meaning he already has a distal biceps tendon rupture on his arm. But the thing that's interesting here is if you look at his hands, you'll see that both hands are held in pronation. And this is because he is unable to generate power in supination on the injured side. He successfully makes the lift. But we can see the effects of the increased intrathoracic and intra-abdominal pressure on his face, as we can see that he has blood streaming from his nose and his mouth. So here we have a weightlifter who's attempting a very heavy squat, well in excess of 700 to 800 pounds on the bar. This weightlifter is a very large man and he looks to be well equipped to lift this weight. So he takes the weight off of the rack, takes a few steps backward and sets his feet in order to begin his squat. However, we can tell before he even starts squatting that he has set himself up for a problem. Well, if we look at his foot position relative to his knee position, we can see that he has placed his knee into a position of valgus. His knee position is inside the placement of his feet position. Normally, if you were going to lift this type of weight, you would want to make sure that your alignment at the knee was neutral or slightly inverse, meaning that the knee should be slightly outside of the line between your hip and your feet. In this case, however, he has set himself up with his knee position inside the line from his hip to his ankles. If we know anything about ACLs, we know that this position is an ACL or anterior cruciate ligament killing position like no other. We can see that his left knee falls further into valgus and then completely collapses beneath him. And as soon as his left leg is gone, then the weight comes crashing as the lifter falls backwards down to the ground. Given the mechanism of injury, we can assume that he has suffered an injury to his MCL or medial collateral ligament as a result of this valgus positioning. It is also very likely that he has also injured his anterior cruciate ligament. And it is possible that he has suffered a knee dislocation with multiple ligament injuries. He may have also injured either one or both of the menisci in the knee, and he may have also suffered fractures of either the distal femur or the proximal tibia. But at any rate, his knee is not going to be the same after this. And unfortunately, sometimes this is the price you pay when you're attempting to lift the heavy weights. So in this next video, we have a participant who is at a competition and he is preparing to do a squat. So he's already got the bar on his back, but right away, when he's only about halfway down, you can see that his right leg kind of buckles a little bit. Fortunately for him, he has the spotters there who are able to grab the weight as he starts to lose control. And you can see that as soon as the weight is off his back, he begins screaming and he starts touching down at his leg right above the knee. And if we think about what lives there, we know that the quadricep tendon, or the point where the quadricep muscle attaches to the patella or kneecap, is right at that spot. And we can see him touching that area. And if you look really closely, it looks as though there may be a defect or a divot in that area just above the kneecap. That would be the area where the quadricep tendon attaches to the kneecap. I don't really suspect a fracture here because you can see that as they lift him away from the platform, his leg maintains its continuity. In other words, we don't see that his leg is flapping around in the breeze. He's able to keep the leg straight and relatively extended. However, he is not able to fully extend the knee, which is as we would expect if he had a quadricep tendon rupture. Tendon ruptures typically occur when the muscle is being exposed to what we call an eccentric muscle load. And there are different types of muscle contractions, of which eccentric contractions are one type. And for eccentric contractions, the muscle is basically trying to generate force as it is getting longer. And in terms of muscle contractions, this is the most difficult type of muscle contraction for the muscle to perform. So here, because he is descending in the squat, the quadricep tendon is lengthening, and therefore it is being subjected to an eccentric muscle load. Tendon ruptures are more likely to occur in tendons that have been exposed to chronic inflammation, such as in tendinitis of the tendon or in tendinosis of the tendon. So it is likely here that he probably had some issues with quadricep tendinitis in the past. And obviously, lifting such a heavy load was probably just too much for this tendon to handle. So let's move on to the next one. So again, for this one, we have a young man here who is in a competition, and he is going to attempt a squat. And we can see here that he is able to successfully control the weight right down to the bottom of the squat before all hell breaks loose. At the bottom of his squat, just before he starts to dig himself out of the hole, we can see that something occurs on his right leg. He collapses to his right hand side. Fortunately, he has the spotters there to grab the weight, although he does get somewhat crushed by the weight as he is falling backwards. And we can see that the weight basically causes him to fold forward over top of his foot. We know here that he has suffered some type of proximal tibia fracture. And this may be a fracture below the surface of the joint, which would be a fracture at the level of the tibial metaphysis. Or this could be a fracture of the proximal tibia, which involves the articular surface, such as a tibial plateau fracture. And this fracture likely occurred as a result of the tensile forces occurring at the proximal tibia as he was lifting the weight. And what I'm talking about here is bending forces at the level of the upper shin bone as a result of the relative position of his foot and his knee while lifting, as well as the angular force generated as he drives his knees outward to push himself up from the bottom of the squat. This is an injury that will require an open reduction and internal fixation with a plate and screw construct. So once again, I've been reviewing weightlifting injuries, except this time we had more of a lower body focus. If you liked the video, be sure to give us a big thumbs up and let us know in the comments section. If you're new to the channel, subscribe and hit the notification bell. And as always, that's been a word from Dr. Chris, not your everyday ortho.
Just a flesh wound.